What are some of the biggest compliance risks that you see medical groups unknowingly taking? And then what are the real world consequences of getting it wrong?
You know, one of the biggest risks I think that we take for granted is protecting our patients' health information. And HIPAA falls under compliance. We are responsible for making sure that our patients and all of their information is protected. And when we become government entities, government contractors through Medicare, Medicaid, federal payers, we are telling the government that we are going to protect that information.
Yep.
And we take for granted all of the different methods that bad actors can get to that information.
Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone, and welcome to this week's episode of Medical Money Matters. I am joined today by Jodi Faustlin, who is a self-described compliance nerd. I like to call her a national compliance guru. She spends a lot of time managing physician practices earlier in her career and realized that compliance was one of the biggest opportunities for improvement and action. And from that, she's decided to devote her career to working with medical groups on all things compliance. So we are also delighted to have her as part of the senior consulting team at Healthy Practices. And Jodi, I'm really excited that you and I get to have this conversation today. So welcome.
Thank you.
Thanks.
I'm happy to be here.
Thanks for being here. It's great to have you. So let's jump right in. I'm going to guess that many physicians and administrators in our audience might perceive compliance as a bit of a burden. And so I'd love to hear your perspective on why you actually think that good compliance planning is a strategic advantage for medical groups.
You know, I think there's a lot of reasons, but what comes to mind most frequently are improved trust and improved efficiencies. Because when you have a strong compliance program, policies and procedures, consistent education and training and those kinds of things, you're all aligned on the same goal, moving towards the same direction. And you have a culture that wraps around those things. So you trust each other more. You know what you're doing. You're also creating the sense for the organization and for your customers, your patients, that you're an ethical organization and you do things the right way, even when no one's looking. When you have that culture of compliance, we do the right thing because it's the right thing to do.
Yeah.
And then there's, the feds and all those folks that they'll come in and they'll give us some fines and audits and things if we can't demonstrate that we have an active engagement in compliance.
Yeah, well, that's great. You and I have both been in the business for a long time, but I can tell when I walk into a medical practice if they have a focus on compliance. It kind of just feels like everything's buttoned up, like they're coordinated, everybody knows what their part is, and it feels different somehow.
Absolutely, it does.
Oh, yeah, it's so great. Well, what are some of the big, I'm kind of like leaning in a little bit because you said, okay, the feds and those people will come. What are some of the biggest compliance risks that you see medical groups unknowingly taking? And then what are the real world consequences of getting it wrong?
One of the biggest risks I think that we take for granted is protecting our patients' health information. And HIPAA falls under compliance. We are responsible for making sure that our patients and all of their information is protected. And when we become government entities, government contractors through Medicare, Medicaid, federal payers, we are telling the government that we are going to protect that information.
Yep.
And we take for granted all of the different methods that bad actors can get to that information. And I think the other biggest risk is the naivety. The government, the auditors, they don't take, we didn't know that rule as an excuse. They expect us to know all the rules and follow the rules and it can get really complicated. One of the things that I enjoy about compliance and being the nerd is I can take the time to understand things and help translate it to the caregivers. I'm not a caregiver. I do not have that skill set. I'm grateful for the people that do, but from a compliance perspective, I'm here to try to make things simple for you, understandable, so that you can enact those things, because it is difficult to read through all the regulations, and nobody wants to do that if your responsibility is patient care. So the risks are making sure, the biggest risks I definitely think for practices are understanding all the different ways that we need to be protecting the patient's information, and understanding all of the risks that we face as a healthcare entity with fraud, waste, and abuse. And you can think about compliance also with OSHA and workplace safety and things like that, and doing the right things for our employees. There's so many different avenues that can fall into compliance. It's a lot for one person that's also dedicated to patient care to try to grasp. So it's a risk if you don't have somebody that can help you with those things, I think.
Yeah. I'm glad that you mentioned HIPAA. My best, and you're going to tell us some real world stories here in a few minutes. My best real world story that just came to mind when you said HIPAA was, we had a group here in Oregon back in the day when there were still paper charts. They had stored their old, outdated paper charts in a storage unit that was locked, and they felt like that was appropriate. And there was a large data breach, and the feds finally traced it back to this particular practice, to patients who'd been people that had been patients previously with this practice. And the practice was completely puzzled, and they said, no, we're not sure how could we possibly be the common denominator. And the feds kept pushing, and they finally took them to the storage unit, and they said, see, everything's fine. The storage unit is fine. Well, when they opened it up, the thieves had tunneled through the adjacent storage unit through the wall in the back
Oh
of the
my
storage
goodness.
unit. So the practice was, even people coming and going to get charts out of it were unaware until this breach came to light and the feds investigated it. So there's a war story for you on compliance issues, but hopefully not a lot of practices have storing paper charts anymore. But
I know of some practices that experienced some issues like that with the hurricanes that went through the Southeast in the fall.
yeah,
And how do they handle their storage areas getting damaged by water? And what do you do when you need that information, but it was still paper? How do you handle all of that? So that's another compliance issue, is what happens when you've had records and unintentionally destroyed
yeah.
that you may need for patient care, or the patient may need, and understanding what you have to do in those circumstances. It can be really overwhelming if you're not prepared.
Yeah, absolutely. Well, and just dealing with business continuity issues to begin with, and then you have issues with medical.
Absolutely.
Yeah. Well, maybe if you could talk with us a little bit about some of the bigger compliance risks that you see for groups, and what are the maybe things they take on unknowingly, and real world consequences when they get it wrong. Did I already ask you that question, Jodi?
Well, I'd like to touch on one of the biggest requirements when we talk about protecting patient information. The HIPAA security rule requires all organizations, all covered entities, to conduct a risk assessment. And what we're seeing as we have more and more cyber breaches, that gets reported to the Office of Civil Rights, because they're the ones that enforce HIPAA. And then after they get done with their investigation, we're seeing more and more. The Department of Justice is following OCR. We're doing a secondary investigation to see if the practices are actually conducting risk assessments, which also evaluates your cyber structure. What are you doing to protect that information? And then if they've found that you're not doing a risk assessment, or you haven't acted on the risk assessment, they are issuing additional sanctions on top of what OCR is doing.
Okay.
So you get the double whammy. And a lot of folks aren't aware, have never done a risk assessment, much less followed through on it. So I think that's one thing that a lot of practices don't realize they need to be doing, but is a really helpful tool to help you prioritize, especially if you're trying to build a program and you start your compliance moving. A risk assessment is a really good foundational step to take
Yeah.
to help you figure out where your biggest opportunities are and how you can mobilize within your organization to start to attack those
Yeah.
things.
Oh, that's fantastic. Well, and that's a great segue too. You and I were talking a little bit about if a group doesn't have a formal compliance program in place yet, where they could start. So it sounds like that HIPAA risk assessment is a good one. What's the easiest way? Because this could be kind of overwhelming. I mean, if you just stop and think about all the alphabet agencies you just named, like, oh, there's all these regulations. And so if a group hasn't really started or if it's a bit disorganized, what's the best way for them to put the right structure in place?
There's always a consultant that you could bring in to help you that can examine what your processes are now and help you insert or create new avenues, help you build that foundation. The one of the things that I always use as the foundation of any compliance program is a document that Health and Human Services put out in November 2023 that outlines the 7 elements of an effective compliance program.
Great.
And it takes you through the steps of describing why a compliance program is important, why they were created, and here is what you need to be doing: training and educating, communicating with your staff, having an opportunity for staff to report compliance concerns. But I think foundationally, you have to start having the conversations in the organization. What do people understand? What do they know about compliance? Does it scare them? Are they curious? And you can get a feel for all of your teams and their understanding, which can also help you figure out what your benchmark is.
Yeah.
And I will say too, if you're ever involved in an audit or any kind of investigation, just like we say with the medical record, if you didn't document it, it didn't happen. You want to document that you're having these conversations with your workforce. And what do they think of compliance? What are you finding? Here's what we're going to start doing. We've got some opportunities to improve. And then once you keep those records, you can show all of your efforts to establish compliance so that you're meeting the expectations of the Office of Inspector General and all those folks that watch us.
Yeah, yeah. Well, that's fantastic and a great thought just about documentation, because I think a lot of times we have the conversations, but we don't think to document that we did that.
Mhm.
And that's crucial. Well, let's shift gears a little bit, because I know there's a lot of misconceptions out there that compliance is simply about avoiding penalties. So I'd love to, and you've said this to me before, I'd love to hear you talk about how you feel a strong compliance program actually improves patient care and practice efficiency.
Absolutely. I think when you have a strong compliance program, number one, we're meeting the expectations to reduce fraud, waste, and abuse. That's what the feds are honing in on from their perspective. So a strong compliance program is going to create policies and procedures that keep everybody aligned, following the same regimen, so that we're doing the same things, we're following the same track. We understand the expectations of ourselves, and we know if there are consequences for not following those expectations. All of that helps increase trust in the organization. A strong compliance program also will help with efficiencies, because when you have all these policies and procedures in place, you don't have everybody doing one function 10 different ways.
Yep.
You've outlined the expectations, so you're moving in the same direction, you're doing the same things. That can trickle down into literal efficiencies in operations, efficiency ordering. You can make sure that you are, at the efficiencies in your billing and coding. That's also compliance. When we think about fraud, waste, and abuse, we've got anti-STARC, physician self-referral, the overutilization and medical necessity. All of that falls under the umbrella of compliance. And when we have a strong program, we are doing things like auditing our charts for documentation accuracy. We're monitoring daily activities to make sure that we're not dropping charges before our charts are fully closed. We're doing things like checking denial reports. Do we have any trends in denials? But we're also collecting information. A strong compliance program empowers our teams, our workforce, to communicate with us if they've got compliance concerns. so that we can address things when they're small instead of hearing about it from an outside entity. When you've got that strong culture within the organization, you're all aware, these are the things that we need to be doing. This is why we need to do it. And it's going to save us money. It's going to save us time. And the worst case scenario, when you've got a strong program, we're all going to have some kind of compliance issue. It's unavoidable because things happen. We're human.
Yeah.
When you've got that strong program, the worst case scenario of an audit or a federal investigation, it helps reduce those penalties that can come because you've shown a good faith effort to do the right thing and follow the rules and regulations.
Yeah, yeah. I love that advice. And that's a good lead in to our next question about I'm curious about some common red flags that you see that could signal compliance issues for a group and how administrators and physicians can proactively address those before they become big problems. Like you just said, we like to get things when they're small and address them that way. So what are those red flags? What do you see?
The first red flag that comes to mind is if the practice isn't doing any self-auditing of their claims before submission or after submission. If they're never taking a look and just pulling a few charts here and there for all the billing providers, that's a red flag to me.
Okay.
A lack of policies and procedures or a lack of consistent following and enforcement of those policies and procedures is a big red flag to me. That indicates there's not a strong culture and buy-in to be compliant.
Yeah.
And I think from a visual perspective, one of the big red flags is if I can walk around a practice and see a lot of PHI, a lot of patient information, patient names, computers not locked up. I can see the schedule with all the patients. That's a big red flag because it indicates to me that folks just aren't engaged in their vulnerabilities.
Yeah. Yeah.
That would definitely, and those start with conversations of, okay, we've got some opportunities here. You may not, like on the PHI example, you may not realize, but you have patients that come and stand up at your nursing station and you've got the full patient schedule right here for all of you to see from an efficiency standpoint so you can work together, but it's a big vulnerability. So how can we achieve the goal that you need to get to the schedule quickly without jeopardizing the information? So starting small with those conversations, always keeping in mind the goal is, what are we trying to do? We're trying to make things easier, more efficient. So how can we do that, but tweak the process so it's also compliant?
Yeah, that's a great example. And so that could be your and my invitation to everybody listening is the next time you walk out of your office or walk into your practice, have a look around from a naive perspective and see exactly how much PHI you can see, when you're in public areas of the clinic and even when you're in the exam rooms too. I mean, if screens aren't locked down, that's the easiest thing to train. And when I go into a clinic as a patient, one of the things I see most frequently is,
Yes.
and of course, you and I probably go in like patients exactly the same way. We're looking around, for all this stuff. Hey. So that's I always my daughter hates to have me go to the doctor with her or to go with me. She's because I'll sit there and count ceiling tiles to see how big the exam rooms are, and then I'm looking at all the equipment they're using, and
my doctor's office hates me because I always make sure that they have the notice of privacy practices available at the front desk. Do you actually have it in case somebody wants to look
rather
at
than
it?
just here's the topaz thing, put your signature on something blindly, please. Yeah. I get that one a lot. That's so funny. Well, thinking about this, it's kind of like the best way to eat the elephant, right? But one bite at a time. So I think about the sheer number of regulations and how often they're changing. I mean, like constantly changing. So what would you say is the best way for medical groups to keep up without spending, hours and hours and hours combing through legal updates?
The associations that we have access to are great resources. There's also, you can work with people like me as a fractional compliance officer. There's a lot of people out there that do this, and we are tracking, because we're dedicated to compliance. We're tracking the different associations and how they're interpreting the guidelines or the proposed rules that are coming out. I track them myself. I have been known to actually read federal registers and state registers on a regular basis. Again, back to the compliance nerd.
Yeah.
but there's so many things. It's training yourself on where to look, and it's a lot easier to rely on somebody to do that for you, whether it's your associations or someone that you've engaged to work on compliance with you.
Yep. Yep. I know in the years when I was actively running medical practices that compliance is important, and it wasn't my forte as a leader. So I would always find someone on the team that was really interested and good at it and kind of allow them to be the, sort of the spearhead. And then we always had support, like you say, from associations and external consultants is a great thing to, outsource part of it, especially for smaller groups. And we'll talk about those in a minute. But I'd love to hear from you a real life story of a practice that faced a compliance challenge and then how they turned it around and what lessons you think others might learn from that.
The scariest compliance experience I've had is receiving a letter from the Department of Justice. And
Oh,
this was several years ago,
yeah.
inquiring about some coding practices that had already been changed and were okay at the time. But at the time that they were auditing, you weren't allowed to submit these two particular codes at the same time.
Oh, okay.
And the practice thought they were doing everything appropriately, had a computer algorithm built that was supposed to catch this and make sure that it never happened, that these two codes would never get submitted at the same time. And after a lot of investigation, a lot of working with the practice attorney and the assistant U.S. attorney, we figured out that it was a simple mistake in the algorithm that was built where the dates were put in alpha order instead of numerical order. So
Oh,
the algorithm wasn't recognizing properly when not to submit the two codes together.
mhm.
And we demonstrated all of this to the assistant U.S. attorney. And because we could document the dedication to compliance, we were trying to do the right thing. We had all the intentions. We were educated. I mean, we had copies of the education materials that were provided to the providers on this is what we can't do and why. And board meeting minutes saying, here's what the program that we're doing, but
Yeah.
everything we could do to document we were doing it correctly. And because we had all that documentation, we had the demonstration of trying to do the right thing, that we understood the regs. And then we did not stop until we found why it occurred. The Department of Justice just asked us to refund the claims that shouldn't have been billed. It
Wow,
was
that's
that
it.
simple.
Wow.
No press release, no fines, because they can do treble fines in those instances. And it was very scary, but it was the best case scenario because we had that culture and dedication to doing the right thing.
Yeah.
And we documented it and could demonstrate it. So it was a learning experience of, okay, that worked, that
Yeah.
we were on the right track, but we still had errors. And like I said, you're still going to have compliance issues. The best efforts and the best intentions, things are still going to happen.
Yeah.
So you keep track of what you're doing, watch for trends, and it will be in your favor for sure.
Yeah, that's great. That's a great real life story. And again, all best intention, and then you have a little woo-ha in the software, and
Yeah.
yeah, suddenly things are going out, inappropriately. Great example. And we talk a lot about technology in this podcast series, and we have to make sure our technology is really serving, like what we want.
Yeah.
Yeah.
I
Well,
think, speaking of which, I'm hearing a lot about folks asking, can they use AI in healthcare?
mm,
Because there are so many opportunities to help with documentation or
yeah,
auditing yourself. And one of the first things that I always tell people is don't use a free AI platform
yep.
because you're not going to get a business associate agreement. And
Mhm.
anytime you put PHI into a free platform, they can do whatever they want with your
You have no
information.
no control over it after that. Yeah, yeah. That's
So
great advice. That's probably worth the price of admission for anyone listening today, isn't it? Don't use the free AI. And you said something else important too, and I'm always surprised. Any group or entity that your practice works with that might have access to your PHI, the practice needs a business associates agreement on file. And we routinely do those with all of our clients, whether or not we expect to see PHI, because we just feel like, we're in doing lots of different projects and lots of different consulting. And so for us, there's a high likelihood that eventually we're going to bump into something that has PHI on it. And I'm surprised the number of times our clients ask about that. And I routinely say, this is for you. I mean, it's for us too, but it's really for you as the practice. So, and that's something we spend a little bit of time on in our physician leadership group as well. And the training for high potential physician leaders is what the BAA is and why you need to have it. And those are pretty simple and straightforward to get done, given that we have tools like DocuSign today. It's not hard to get them done, but it's just, it's a matter of having that, like you said earlier, having that as a discipline.
I like to think of the BAA as a trust but verify document.
That's a great way to put it. I like it. Good Ronald Reagan reference too. That's awesome. But yeah. Oh, well, that's a good lead on where this conversation is flowing so beautifully with all the questions that we have. So my next question for you is really around, the fact that a lot of people think that only large healthcare organizations really need compliance officers and really need to pay attention to compliance. So what would you say is the right level of compliance oversight for the small and mid-sized groups?
You don't have to have somebody that's doing compliance full time, dedicated to it. You can have a consultant, you can have somebody that's wearing that hat in addition to a couple others. But the key is part of your management team or your leadership structure needs to regularly talk about what you're doing to reduce risk in your organization. Mm-hmm. That's the key. When Health and Human Services first started compliance programs years ago, it was all about preventing fraud, waste, and abuse. So every organization, if you submit a bad claim or you sign a bad contract or you inappropriately reimburse a physician for their work, you could be inadvertently subjecting yourself to a potential violation, committing one. So I think having a quarterly discussion about what risks do we have, how can we mitigate them, do we need help to mitigate these, those kinds of things. But having an agenda item, even for a small practice that's got one or two providers and the manager, regularly dedicating time, and the Health and Human Services recommends that we do that quarterly at a minimum, but dedicating time to talk about what risks do we have on the agenda and documenting your conversation so that you have that demonstrated acknowledgement, and talking to your teams again about what is your understanding of compliance? What can we do better to help you understand what we're obligated to as a healthcare provider? And start with those basic conversations. And then, you can't eat an elephant at once. You take one bite at a time. So you build into it. Yeah. But we're all expected, if we take federal funds, we're all covered entities and we're expected to follow the rules.
And to have a program in place. I love that notion of a discussion about risk. That's something we also talk about a lot in the Physician Leadership Project, is thinking about, all different kinds of risk. I mean, there's fraud, waste, and abuse risk, there's compliance risk, there's the risk that, if one of your, physician owners is hitting on the receptionist, that creates risk for the group, so we kind of have talked about those kinds of things. If the physician that's the fiduciary for your 401k is taking money out of the plan and gambling with it, that creates a risk too, so, and those are both real world stories. I'm sure you've heard a lot of good ones too, but, it's, and to think about a little bit of taking sort of the right wrong out of it and just talking about levels of risk and like, what's the potential outcome if we allow that to continue, or if we don't have a policy or procedure in place, and if we haven't trained people. So I find that thinking about it as risk takes a little bit of the emotion out of it, and it allows you to make business decisions around what needs to be done. If you think about whatever the behavior is or whatever is missing, and what kind of risk that creates for the business, and then how you mitigate that. A lot of times we mitigate risk with policies and procedures. A lot of times we mitigate it with training. Sometimes we mitigate it with an insurance product. We go out and buy some. Yep. So, but I like that risk for me is a very clean discussion, right? Mm-hmm. it takes a lot of the morality out of it or anything like that. It's just, look, let's talk about the risk
Right.
that's being.
Exactly. And then you talk about within the organization, what is your risk tolerance?
Yeah.
There are some things, the example that comes to mind is when you're sending PHI electronically, are you encrypting it?
Yeah.
You're not required to encrypt it, but what's the risk if you don't?
Yeah.
And what alternatives do you have? Everything it can fall under that risk assessment, just like your financial investing. What are you willing to tolerate?
Yeah. Yeah.
And what are you willing to pay if you figure out that your mitigation strategy wasn't enough?
Yeah. Well, that's a great cover. You and I could probably have a whole nother discussion on risk tolerance and risk mitigation. I will say the vast majority of physicians that I've had the privilege to work with over the years are, in general, pretty conflict avoidant. And I think that goes sort of hand in hand with being a really great caregiver and a healer and a person that takes care of their fellow man and woman. And I see those critical conversations sometimes that need to happen. And so I like actually thinking again about risk and also about compliance too, because then you can kind of make the alphabet agencies into the bad guy. When you say, hey, we need to really button this up, or we can't do X, Y, and Z. It's nice to have somebody else to sort of put that onto, some other entity. But
Absolutely. I can't tell you how many times I've used the phrase, don't kill the messenger.
yes, exactly. Yeah, please don't. I'm just bringing you the news. Yeah. Oh, that's great. Well, I will say, as a former auditor, I can ask this question. I know audits can be really stressful if you're at the clinic and you're on the receiving end of that. So what would you suggest are steps that medical groups can take to get themselves to being audit ready, without feeling like it's taking forever and they're drowning in paperwork?
The first thing that comes to mind is doing your own daily monitoring, watching for trends. The biggest thing from an auditing perspective that I would always watch for is, what are our insurance companies asking of us? Whether it's denials that we're having to appeal, are we having problems with that? And we can internally audit from there before we get a big audit. But also, you're tracking what you're hearing from your peer groups. Are they getting a lot of audits and things? Communication, tap into your other physicians in your region and other practice managers. What are they hearing about? What are they getting audited on? The best audit prevention is to do it yourself first.
Okay.
So regularly pulling, a statistically significant number of charts on all your billing providers just to see how they're doing, and re-educate if you need to, correct claims if you need to, or give kudos and praise people that are doing well, because we forget to do that so often that we're just expected to do the right thing. But praise and incentivize when people do the right thing. And that also helps with that culture of compliance that, hey, it does make a difference when I'm doing the right thing. People are paying attention.
Yeah. I always like to say, catch them being good, right?
Yes, exactly.
Wonderful. Wonderful. Well, I have loved this discussion, and I would love to bring it all home with one last question for you. And that is, for a practice that is struggling with compliance, or if we have any of our listeners are out there taking a deep breath right now going, wow, what Jodi's talking about sounds really big. What's one simple action that they could take today that would have meaningful impact?
I think either walking around and looking at your risks for PHI, that's the easiest one I can think of. Just think about what are we vulnerable for in that area, or just start having conversations. The more we talk about it, the more comfortable we feel with it. And then we can find within our organization people who might have a passion for it or might run from it and might need a little extra help.
Yeah.
But it always starts with the conversation of, this is important, and it's going to be a process, but it's one step at a time. And I will say, sometimes you might feel like you're doing a cha-cha where you've got a couple of steps forward and then a couple of steps back, but we've still got the progress of the dance and we're doing it. And It really is. You start with the conversation.
I love it. I love it. Well, Jodi, thank you so much for being with me today and for sharing your expertise with our audience. I so appreciate it. And we'll get all of your contact information in our show notes so everybody can reach out if they have further questions. So thanks again.
Thank you. It was a pleasure. I appreciate it.
Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/codemastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.